Hi, can I please get you to state your name, your date of birth?
Dylan Trujillo, October 22nd, 1991.
Any allergies?
No.
Okay. My name is Cassandra and I'm going to be doing your physical exam head to toe. This is for my BSN project for health assessment and my student ID. Alright, Dylan, do you consent to this assessment?
Yes.
Do you consent to me putting this online?
Yes.
Alright, so I'm going to go ahead and start out assessing his level of consciousness. Dylan, do you know where you are right now?
Yes.
Where are you?
At home.
Okay, do you know the year?
2022.
And the date?
November 20th.
Okay, and who's the president?
Joe Biden.
Okay, so from those questions, I can see that he's a learn-oriented ×4. Dylan's appearance appears appropriate. He's dressed appropriately. Hygiene looks good. No odor is apparent at this time. Dylan's affect is fine. His mood looks very calm and appropriate for the assessment. Just looking at his skin from here, it seems to be clean, no lesions noted. So I'm going to go ahead and we're going to start with your hands. So I'm going to go ahead and look at his hands, looking for any lesions or bruises. Skin's clear, checking cap refill in both hands. Capillary refill is good, less than 3 seconds for both hands. While I'm here, I'll just check his radial pulses bilaterally. Both are strong, equal, +2. All right, Dylan, I'm gonna go ahead and start by checking your head. So when I'm looking at his scalp, I'm going to be looking for any tenderness, any lesions, any bruises. Scalp appears clean. All right, does that hurt at all?
No.
Okay. All right, now I'm gonna go ahead and look at his face. I'm looking at his face. His nose is midline, his mouth is midline, his eyes appear symmetrical. So I'm going to go ahead and press on your sinuses. If any of this hurts, just let me know. Pressing on his sinuses. Any pressure noted, Dylan?
No.
Okay, I don't see any redness. There's no pressure. So while I'm here, checking his temporal arteries. Both are equal, strong, present. Alright, Dylan. I'm going to go ahead and test your lymph nodes. Any tenderness here?
No.
Okay, have you been feeling sick at all? Any flu-like symptoms in the last 7 days?
No.
Okay. Alright. Testing his mandible. If I'll have you go ahead and open and close your jaw for me. Any difficulty?
No.
Okay. Okay, so now I'm going to have you stick out your tongue for me, please. Awesome. Put it back. Wonderful. So testing his cranial nerve right there, he was able to stick out his tongue and also put it back. So moving on to his eyes, I don't have a Snellen chart with me, but beforehand the patient stated that he does have 20/20 vision. So what I'm going to go ahead and do right now is I'm going to check for accommodation. So I'm going to have you look at the wall behind me, please. Look at the wall right behind me. Now stare at the pen. Okay, so checking for accommodation there. All right, I'm going to go ahead and have you just keep your head still and follow my pen with just your eyes. Looking for any nystagmus, not noted at this time. Okay, and then I'm going to go ahead and check for pupillary constriction using a light. Good. Okay. bilateral pupillary constriction was noted for him. So I'm gonna go ahead and ask you to please shrug your shoulders. Okay, look left to right for me, please. Any difficulties? No?
No.
No hurting or anything?
No.
Okay, awesome. So now I'm gonna go ahead and check Dylan's ears. So I'm gonna go ahead and start with this one right here. So looking at the outer ear, I'm looking for any redness. Is it tender at all?
No.
Okay, so no redness, no tenderness. All right. So typically I would have an otoscope so I can look into his ear, but I don't. So just looking here, I wouldn't be able to see in his canal, but I would be looking for gray pearly and inner canal. And as far as his tympanic membrane, there should be no inflammation, and he doesn't appear to have any kind of hearing issues. I'm not having to repeat my words or raise my voice for him to hear me. All right, done. Now I'm gonna go ahead and assess your thyroid gland. So I'm gonna go ahead and with his thyroid, I'm looking for any enlargement, any goiters, no noted goiters, any tenderness here.
No.
Okay. Any tenderness on your neck?
No.
Okay. All right. So now I'm gonna go ahead and have you lay flat for me, please. Okay. So the first thing I'm gonna do is I'm just gonna look at his appearance. He does have a shirt on, but we're not gonna lift that for professional purposes for the internet. So just looking at him right now, I see that his abdomen looks symmetrical. I don't see any pulsations in his abdomen. It's not distended in any way. So that looks good. His skin appears to be intact, and so I'm going to go ahead and assess for his jugular vein pulse. So Dylan, would you please turn to the right, just your head? Thank you. So the first thing I'm going to do is I'm going to find his sternocleidomastoid bone, which is right around here. I'm looking for any JVD as well along here. No noted JVD at this time. So once I have located that, right behind it, I can check for that. And it appears to be strong and +2 pulse. The next thing I'm going to do is I'm going to go ahead and listen to his heart. I'm going to do his apical first. So I'm going to find his apex, which is going to be the 5th intercostal space mid-clavicular line. So just looking, feeling. So it should be right here. So I'm feeling for that once I find it. Okay, I'm gonna go ahead and listen. Apical pulse for a whole minute. All right, 65 beats per minute. So now I'm gonna listen to his aortic. listening for any murmurs, any galloping, pulmonic, tricuspid, mitral, when I was listening to any of those, I didn't hear any galloping, no murmurs noted for him, so it sounds good. I'm going to go ahead and, while he's here, check his carotid bilaterally. And the other side. Carotids are both strong bilaterally, +2 pulses. So going back to his abdomen, I've already inspected it. So now I'm going to go ahead and listen to all 4 bowel sounds, making sure that we have activity in all 4. So all 4 quadrants are active bowel sounds. Dylan, was there any tenderness when I was doing that?
No.
Okay, so now I'm going to go ahead and I'm going to percuss Dylan's abdomen, hoping to find dullness on top of the solid organs, especially the stomach. So right up here is going to be Dylan's liver, so I'm going to go ahead and percuss. Dylan's spleen. Okay, now I'm going to do light palpation. So I'm going to lightly palpate his liver. No tenderness, no guarding. Okay, now more of a deep palpation of his liver. I'm not feeling any enlargement of his liver. Spleen. No enlargement of his spleen. Okay, checking his kidneys. No tenderness. Okay. Moving down to his lower extremities. So I'm looking as far as symmetry, they look good. One leg is not longer than the other one. Checking his skin down here. I'm looking for any lesions, any bruises, cellulitis, edema. No edema noted. Hair seems like it's growing healthy for his age. So I'm going to go ahead and have you just slightly bend your knees for me, Dylan. I'm going to be checking his popliteal pulses. All right, pulses are both present and strong. Go ahead and check his pulses down here. All right. Okay, skin feels warm, dry. Like I said, no edema is present right now. I'm going to check his capillary refill. All right, I'm not noticing any clubbing or any discoloration on his skin. No pigmentation noted. So I'm going to go ahead and have you lift one leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, the next leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. Now, can you press down against my hands? Good. Now press that. Oh, good. Okay, Dylan. So I'm gonna go ahead and have you sit up for me. So checking his lower extremity and his muscle strength, he was able to lift both legs, keep him in the air for 10 seconds. He was able to press down against force, press up against force. His capillary refill on his toes were less than 3 seconds. So Dylan, I'm gonna go ahead and check your upper arm motor strength. Go ahead and leave him up for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. Go ahead and squeeze my fingers for me. Good. Now release. So he's able to follow commands. His upper motor strength seems equal, strong, and just as his lower extremity strength was equal and strong. When I was doing the hand grip, I was also testing another neuro for him, as well as keeping his arms and legs up. That's another neuro thing. And he was able to complete all those tasks. The last thing I'm going to do, Dylan, is I'm going to go ahead and check your nose and your inside of your mouth. So just looking at his nose, like I said, it's midline, it's symmetrical. I'm going to go ahead and have you look up for me. Okay, so I'm looking for any deviated septum, which when I was doing a history with Dylan beforehand, he did have a surgery back in 2019 to get his deviated septum worked on. So now I'm looking. Can you please take a deep breath in through your nose and out through your nose? Any difficulty?
No.
Okay, so it's patent. Going ahead and looking inside of his nose with the light, since I do not have a speculum. The inside of his nose appears to be moist, pink. It doesn't appear to be inflamed at all. Dylan, can I have you open up your mouth, please? Okay. So looking in Dylan's mouth and looking at his gums, and his teeth appear white, and his gums don't appear inflamed at all. Go ahead and stick out your tongue for me. His tongue looks good. It's intact. No lesions noted. Looking at his tonsils look intact and not inflamed. No swelling noted. Open your mouth. No. His uvula, looking at his uvula, no swelling in his uvula. His mucous membranes, you can close your mouth now. His mucous membranes look moist and pink, which is good. His eyes, just kind of looking at his eyes, his sclera are white. His conjunctiva don't seem inflamed at all. There doesn't seem to be any extra debris. Are they irritating you at all?
No.
No, you don't wear any contact lenses or glasses?
No.
Okay. Go ahead and we're going to do one more cranial test for him. So can you please lift your eyebrows up? Good. Puff your cheeks out. Okay. Good. Can you smile real big for me? Can you frown? Okay. Awesome, Dylan. That was great. So before our test, our assessment today, I went ahead and took Dylan's vital signs. So his weight is 84.1 kilograms. His height is 5'9", making his BMI 27.3, which was normal for a male of his height and weight range. His vision was 20/20. His radial pulse was equal strong bilaterally, being 60 beats per minute. His respirations were 16, even and unlabored. Blood pressure was taken in his right arm, sitting at 116/70, and his left arm sitting at 118/70. His temperature is 98.6, taken orally. And Dylan, are you in any pain right now?
No.
So patient states that he's got 0 out of 10 pain. And I believe that is it, Dylan. So I'm going to go ahead and thank you so much for allowing me to assess you today.